Efficacy of an internal anchoring plastic stent to prevent migration of a fully covered metal stent in malignant distal biliary strictures, a randomized controlled study. Introduction. Endoscopic retrograde cholangiopancreatography, ERCP, has become the standard method for primary palliation of malignant biliary obstruction. Endoscopic retrograde biliary drainage with a plastic stent was first introduced in the early 1980s, and self-expandable metal stents, SEMS, were then adapted to improve stent patency. However, uncovered SEMS have several disadvantages, including short patency time and difficult extraction due to tumor ingrowth and tissue hyperplasia caused by the stimulation of the surrounding tissue by the mesh of the stent. Therefore, fully covered SEMS, FCSEMS, with a polymer coating were developed to overcome the problem of tumor ingrowth seen with uncovered stents. However, FCSEMS carry the risk of stent migration, making them not superior to uncovered SEMS in terms of stent patency. Thus, several concepts to prevent stent migration have been introduced, including higher radial force, an anchoring flap, a flared end, and a partially uncovered metal stent. However, these stents are sometimes difficult to remove because of multiple anchoring flaps or tissue ingrowth through the mesh, which can cause ulceration and bleeding from the mucosa as the SEMS are removed. As chemotherapy improves survival rates, the improvement of SEMS has become crucial for long-term cancer survivors. FCSEMS are preferred over partially uncovered or uncovered SEMS because they can be completely removed and replaced during stent revision. Several studies reported a reduction in stent migration when the FCSEMS was anchored with a plastic stent. However, there are no prospective randomized studies focused on the efficacy of an anchoring plastic stent for prevention of FCSEMS migration in malignant biliary obstruction. The aim of this study, therefore, was to demonstrate the efficacy of using an additional plastic anchoring stent to prevent stent migration of FCSEMS compared with FCSEMS alone in patients with malignant distal biliary obstruction. Background. Two types of SEMS are available for malignant distal biliary obstruction, FCSEMS and uncovered SEMS. FCSEMS can prevent stent ingrowth, but a major concern is spontaneous migration. This study aimed to determine whether the additional insertion of a double-pigtail plastic stent to anchor the FCSEMS can prevent migration. Methods. 68 patients with unresectable malignant distal biliary obstruction were included in this multicenter randomized superiority trial. 33 patients were randomly assigned to receive the FCSEMS plus an anchoring plastic stent, and 35 patients received an FCSEMS alone. After placement of the FCSEMS, the anchoring stent was inserted inside the FCSEMS. The primary outcome was the rate of stent migration during the 6-month follow-up. The secondary outcomes were stent-related adverse events, stent patency, and survival rates. Results. The baseline characteristics were similar between the two groups. The rate of stent migration at 6 months was significantly lower in patients with the FCSEMS plus anchoring stent, 15% versus 40%. The mean stent patency was significantly longer in the FCSEMS plus anchoring group, 237 days versus 173 days. There were no significant differences in stent-related adverse events and overall survival rates at 6 months between the two groups. Conclusion. Data suggests that the additional double-pigtail plastic stent anchored the FCSEMS to prevent migration and prolonged patency without any serious adverse events.